I have edema on my thigh, pink stuff in my eye, and I need you now. I've got a stomach pain that's low, fungus on my toe, and I need you now. He's an osteopathic legend called Dr. Most right now.
7:38, Dr. Kevin Most joins us. Terry, text her. Happy birthday, Nick and John.
Thank you.
Oh, that's very kind.
And 815, welcome to the Rhino Show. I look forward to your vacation, dummy. That's an 815. I told my mom, stop texting. Come on. You know what I mean? You know what I mean? I know. Dr. Kevin Most joins us this morning. Doc, how are you?
I'm good. Wait, is it both of their birthdays today?
John's was actually April 7th, and we just got around to celebrating it.
Right.
Okay.
Well, we get busy.
Yeah. Mm-hmm.
Actually, John, for your birthday, we should give you the first question. Do you have one for Dr. Most?
I do. Oh. Good morning, Doc Most.
John, how are you?
I'm wonderful. Wonderful. Dr. Most is the absolute greatest person I've ever met in my life. I just
Stop kissing up. You still want your insurance card.
I don't tell many men that I love them, but I love Doc Most.
Well, you're not wrong.
Still have to pay your bills.
Still?
Yeah.
Okay. Quick question. My PSA levels, they've been at 0.1 for probably the last 3.5 years. And then I stopped the testosterone treatment, blocker, whatever.
Mm-hmm.
Okay, and now they're at 0.4, and this is a year later. Should I be concerned about something like that?
No, a change like that is not that dramatic. And again,
we should say for the listeners, by the way, you have prostate cancer, and you've been doing all the right things to fight it.
I didn't want anybody to know that.
Well, when you hear a 0.1 PSA, you got guys going, what?
Okay.
Yeah.
Oh,
yeah. The PSA test, obviously, as a blood test that has kind of gone in vogue and out of vogue as far as monitoring, or not monitoring, but diagnosing prostate cancer. But certainly is one that we use when we are treating prostate cancer to make sure that the treatment is working appropriately. And a 0.1 to 0.4, the margin of error there is probably 0.2 or so really not a big change there at all. Okay. I wouldn't be overly concerned. In individuals who get their PSA tested with their physical exam, individuals who haven't been diagnosed with prostate cancer, obviously we're looking for trends. So a single number, we're going to look the next year and see if that changes. And if that changes, then we're going to look at doing additional testing, whether it's ultrasounds or biopsies or MRIs, because prostate cancer is, the number one cancer in men. So certainly one that we want to make sure we monitor, and because it can be treated.
Great.
Does that help?
That does. It's one. He always helps.
Doc, I have a question for you. I was approached last week by Northwestern Medicine for a clinical trial for knee pain, and spoke with some of the people there. And they have me targeted to talk about one study in particular because I take a blood thinner for a hereditary blood clotting issue because there's nothing sexier than a man with clots. And it turns out there is one study that does line up if I were to do it. I've never gone through a clinical trial. Is it something you recommend for people?
Absolutely, and thank you for even considering it. Without clinical trials, we really don't have the answers to what is going to be the next advancement, whether it's in cancer or heart disease or, even knee pain and knee disorders. So certainly having individuals sign up and approve for those is great. And it's one of the nice things about my chart and big data is that we can identify individuals that this may help them. Now, in clinical trials, it's often going to be at least two arms, and I'll explain what an arm is, but at least two arms, sometimes three arms. One arm is going to be you're going to get the conventional treatment. Another arm might be you're going to get the conventional treatment plus a placebo. And then the third would be conventional treatment plus potentially another medication or another therapy. And what they do when they get enough people, they can now compare to say, hey, you know what? We've been doing it this way all this time, but we have just proven by this huge study that this way is much better. So individuals like you fall into this small niche because of not only your knee pain, but also being on the blood thinner. A lot of medications that people use to treat pain actually aren't really good with blood thinners. So this will be a very interesting one, and appreciate you even considering it.
What do you wait for somebody to contact you, or can you search clinical trials out?
Yeah, you can search clinical trials. Matter of fact, if you think about it, during COVID, there was a lot of people searching clinical trials because they all wanted to get on Paxlovid before it was approved. But certainly you can go on and look at the NIH clinical trials and see where and what trials are going on. Depends on the illness that you have. Many cancer patients will be offered a clinical trial just straight out of the box because there's so much going on there. But some of these more obscure ones, often it's going to need to take your doctor being in an educational-based system, such as Northwestern, or it's going to take somebody reaching out and looking, saying, hey, I have this illness. I don't like the direction it's going. What trials are out there?
Okay, good to know.
Dr. Morose, I would like to just talk about the awareness of this topic, because this is a deeper topic that never gets talked about on this radio station or really anywhere. And back in the day, it was like, don't ever talk. And that is menopause and postmenopause. There's a lot of conversation going on today about how women can live healthier when they're learning more about perimenopause, menopause, and postmenopause. There's so many different directions you can go, but hormone replacement therapy and how important estrogen is, and then who should seek help from a doctor. And I just want to hear your thoughts on the importance of talking about the awareness of menopause.
Yeah, Jane, it's interesting the way you ask the question and the question itself, because when you think historically, menopause just happened, right? And you didn't talk about it. You didn't talk about hot flashes. You didn't talk about the other illnesses that come along with it or the other side effects. And finally, we got to a point, and I hate to say it this way, but I think the number of female OB-GYNs that have entered into this field are now more willing and more open to talk to this than men were, and that I'm going back 10, 20, 30, 40 years, when women just said, okay, I'm going to go to the doctor, whatever he says, I'm not going to ask a question. I think now we have more opportunities to not only look to see what are my options for treatment, what should I consider doing, tell me the risks and benefits of all of them. And, and really if you say, hey, the worst is XYZ, okay, well then maybe, having hormone therapy is appropriate. The worst is Y, oh no, you know what, let's do this. So certainly having the opportunity to talk to your doctor about the side effects and about your concerns has changed dramatically, I will say, over the past 20 years.
Yeah.
It's Dr. Kevin Moss. When we come back, we have many other things to hit, including weed, blood tests for cancer, and a different set of rules for COVID going forward as well. Stand by for that. We might even get Glenn's question in about his lady friend with foot odor. But first,
Call Dr. Morse right now.
9 out of 10 doctors recommend 3.5 hours of Steve Cochran every morning on the Big 89 WLS.
welcome back to Turn Your Head and Cough, the soon-to-be award-winning segment. Oh, wait, that was 20 years ago when we called it that, Doc. I apologize.
I was just going to ask you, how long can we continue to say soon?
That's kind of a flashback. Doc, you travel all the time, and I just want to make you aware of something before we move on with medical questions. United Airlines flight with 157 passengers got diverted to Ireland this week after a laptop became stuck in a business class seat. So, a transatlantic United Airlines flight had to turn around. A business class passenger's laptop got stuck in their seat. Nobody could get it out. Sunday's flight from Zurich to Chicago was diverted to Shannon, Ireland. And when the plane landed, engineers came on and they were able to remove the offending laptop. They were concerned that it could catch fire in flight.
Oh.
Wow. I was just thinking, you get a business class to Cleveland, bring your computer, jam it in there. Next thing you know, you're playing golf in Ireland for the flight to Cleveland.
I didn't even think about that. Look at you.
Yeah, he's looking on the bright side of things.
Look at you.
Yeah.
All right, let's talk weed because this makes Miranda happy. The Department of Justice, with President Biden's move of marijuana from a Schedule 1 to a Schedule 3 drug means what?
Well, it's interesting that it took this long because really a Schedule 1 drug is a drug that has a high risk of abuse and addiction. But the biggest other thing is no accepted medical use. So these are drugs like heroin and LSD. But when you think about medicinal marijuana, which we've been using for decades now, why wasn't it moved before? And that is, from a Schedule 1 to a Schedule 3 drug, which has a moderate risk of abuse, but it does have accepted medical uses. So these include Tylenol with codeine and steroids and other medications. So people need to understand that, it's no longer Schedule 1. That means it's legal. No, federally it is still not legal, although it's used in so many, states right now from both medicinal and recreational, but there still is no federal. So it really was more of a administrative move, I would say, and one that should have happened a while ago to accept that there is now many accepted uses for marijuana, whether it be glaucoma or cancer treatments, for nausea. There's a lot of it. MS, a lot of people use it.
There's only 12 states now that allow CBD oil, but not marijuana, and 38 states have approved marijuana for medicinal use. Miranda, any thoughts on this? You're from Big Weed.
Mm-hmm. It makes me really happy because my mom is a medicinal user and she doesn't use any opioids or anything for her back pain. So it's really cool to see.
All right.
And happy for me.
That's a report from that's a live report, Dr. Most from Big Weed. All right, Jane, what's next?
And lots of things have changed when we talk about COVID. It seems to me like there's no isolation period. You can't get a free test. Things have changed, Dr. Most.
They really have, Jane, and we haven't spoken about COVID in such a long time. And it's interesting, just this past week, the JN1 was the predominant strain. It was a strain that just blew up over the country over the past year. And now it's been taken over by a new strain. So it's like, okay, what's going on with COVID? A lot of, like the news that you said, the CDC comes out and says, hey, you don't have to isolate for 5 days anymore. What we're going to ask you to do is see if your symptoms are improving, but also be fever-free for 24 hours without using Tylenol, Motrin, or anything to keep that fever down. So we're starting to treat it more like we are influenza, which is not unusual. Now, it'll be interesting to see with this new variant, the KP2 variant, if it causes a summer bump, which it could, because two of its main mutations are actually one that it makes the immune system not as powerful, and two, it's much more transmissible than the JN was, which is pretty amazing that this little virus is still finding ways to become more transmissible and spread easier.
Will it ever just go away?
I don't think so. I think we're going to have COVID forever. Now it's going to come down to a point of, are we going to start treating it almost like the common cold, or are we going to treat it like influenza? And what I mean by that is, will we have an annual vaccine that we're going to continue to push, or will we just say, hey, you know what, the vaccine's available if you want it, but this now has gotten to be a more mild inconvenience illness than it has deadly. But I can tell you, we still see patients who are immunocompromised, who have lung problems, who still get a simple case of COVID. I hate to say it that way, but still end up in the hospital and can end up in our intensive care unit. So not to belittle it, but it certainly is a sign that the CDC is saying, hey, we're going to start downgrading this a little bit more to make sure that people are not staying out of work or staying away from people longer than they need to.
Doc, as you get older, I'm going to go off the board here, and we have got some good news on blood tests for cancer, but those notes will be attached, and we'll take this up next time. We go off the board here for our friend John DeCoste on his birthday. John has trouble sleeping, I'm told by John, or staying asleep. I hear a lot of folks as they get older, certainly not me, talk about how they wake up in the middle of the night and they don't know why. What can you tell us about it, and what should we do?
Yeah, the study of sleep medicine has just blown up in over the past 15, 20 years. To a matter of fact, we have now doctors who are board certified in sleep medicine. Dr. Tim McGee, a very good friend of mine, is probably one of the foremost authorities in the western suburbs about sleep and sleep history and how disorders. But A couple things. One is you certainly want to find out if one of your problems is sleep apnea, because that can be very, I don't want to say deadly, but certainly can impact your cardiovascular health, can certainly shorten your lifespan. And that's essentially when you stop breathing while you're sleeping to a point where your body says, oh, no, I got to, you jerk awake because you don't have enough oxygen. So that is certainly one. Two, we use too much caffeine products at different times of the day that actually will keep our minds racing and not allow us to get into some of the better sleep patterns. Alcohol use, certainly in the evening, will do this as well. Medications. So really, if you're having a problem and it's a new problem, certainly see a doctor for it. And at least have them do an evaluation where they look at your social history, your family history, your body habitus, and just go over everything to say, here's what we can do. Too many people just take Benadryl every night and really just use it as it makes you drowsy, but in fact it has a rebound effect hours later when it wears off. So there's a lot of science behind sleep, and I would say strongly it's worth getting a doctor's opinion, an expert in sleep medicine, as to what treatments might be
Well,
best.
I mean, you've already helped Johnny. He dozed off when you were answering. Just fell asleep. All right,
That's not surprising.
All right, before you go, Glenn in Evanston, a texter, a young lady I'm very close friends with, has the worst foot odor. Can anything be done to prevent it permanently? She's tried everything.
Yeah, and I don't know what tried everything is, but I mean, if you look at foot odor, it's a combination of sweat, so moisture, and bacteria, and dead skin. So we get a lot of dead skin on our feet just because the body's trying to protect itself with these cushions. So what I would tell Glenn is have her get in to exfoliate the skin as much as you can. May has done that. Wear wool socks. Even in the middle of the summer, wear wool socks. And consider inserts for her shoes. I mean, those are things that will decrease the amount of moisture. And like I said, it's moisture and bacteria that cause that odor. So certainly those would be the things I would at least try.
Well, it seems counterintuitive. Wouldn't wool socks make your feet sweat more?
Yeah.
It wicks away the sweat.
Oh.
Exactly.
Wool?
Oh.
Yep.
Nobody told me.
Where cotton just keeps it right up against you. Again, that's why we wear wool in the winter as well, because we do not want frostbite with cotton socks. So
it's very itchy, though.
That doesn't have to be.
So let me explain. You're a doctor.
Yeah. Seems like he knows what he's talking about. Yeah. Mm-hmm.
And I don't promote companies, but I will tell you, I wear wool socks playing golf all the time. A company called Kent Wool they make great socks.
Really?
Writing it down right now.
Me too. Everyone's writing it down.
Kent
Take note.
Wool.
K-E-N-T.
Kent Wool. It doesn't do weekends on WLSF. Yeah. Thank you, my friend.
You got it, guys. I'll talk to you
Thanks,
soon.
Dr. Mo.
Thanks, Dr. Most.
Kevin Most.